Finishing the casting. Please thoroughly familiarize yourself with this material before finishing your casting. Seal the wax margin prior to casting. Check emergence profile and marginal adaptation. Marginal defects usually require remaking of the casting. After casting, visually inspect the internal surface with magnification for blebs and remaining investment material. Never force the casting on the die, as blebs will abrade the die surface. Use a 1/4 round to remove the bleb. Too much grinding adversely affects the resistance and retention. Check the internal surface. Die spacer should provide space between the die and the casting except at the margin. Use a light coating of fit checker or occlude spray to identify resistance to seating. Clean thoroughly between applications. After seating on the die is satisfactory, remove the sprue with a separating disc and heatless stone. Seat the die on a stone cast. Adjust and polish the proximal contact. Evaluate with an articulating paper. Adjust with green stone or wheel. Avoid over-reduction. Perform occlusal adjustment to bring the pin back into contact with the table. Try the crown in the patient. The first thing to do is adjust the proximal contact. Verify by flossing. Floss should snap. The marginal ridges should be at the same level as on the die. Establish occlusal morphology and adjust the patient occlusion. Points of contact should exist on flat areas. Avoid contacts on inclined planes. Remove defects with finishing burrs. Check thickness of gold. The occlusal surface should have been adequately reduced. Lateral contacts should be removed unless they are intended. As in restoration of anterior guidance. Finish occlusal surface of the casting with finishing burrs, brownies, and greenies. Polish the margins without nicking or over-reduction. Hand instrumentation may be used for softer metals. Beavertail burnisher may be used to burnish soft gold and finish on die. Support with finger to prevent damage to margin. Rubber wheels may also be used to polish margins. Buffing bar compound EEE or BBC may be applied with a soft Robinson bristle brush. Apply rouge on brush or chamois wheel. Clean the crown when changing the fineness of the polishing medium. A finished casting is fully seated, highly polished, margins intact. Proximal contact present and a proper occlusal relationship exists. The crown is anatomically appropriate, with adequate occlusal thickness, and exhibits resistance and retention. The following is a list of crowns that are unacceptable. Rocks in mouth. Marginal ridge heights not same. Not seated. Get explorer under margin. Hyperocclusion, infraocclusion. Look bad. Inadequate proximal contact. Margin not on tooth structure. Bulky. Hole that can't be repaired. Too thin, patient wears hole in casting. Unplanned lateral contacts.